Well, it's just a good organization to donate to. I mean, it just helps people. My name is Tina Maynard. I'm a PCA. I work on cardiac step down. I've also been a cardiac patient here at Cookeville Regional. I was at work. I worked that day, and I had 2 episodes. The first episode, I was in a patient's room. Nobody knew about it because the patient was asleep. But then the second one, I had to sit down outside the nurse's station, and that's when my coworker says, "What's wrong? You never sit down." And I said, "I'm just hurting." And that's when they told me I needed to go to the ER. They convinced me. I would have that tight squeeze in my chest and get real short of breath, and I just had to sit down. But then I got in the ER. They had to give me nitroglycerin. That's when my adventure really started. I had a stress test the next morning, failed it with flying colors, and they took me down for a cardiac cath and placed 6 stents. That was a different experience for me because I'd never been through that. They said I had a strong, healthy heart, or I would have had to have an open heart. Was discharged from the hospital on Friday, took 2 weeks off of work, and now I'm back to work. Oh, the interaction with the cardiac rehab was great from day one. Everybody was so helpful, and they keep you monitored, make sure you're well taken care of, and the 45-minute exercise, you'll feel a lot better. I did. This place is very nice. They've got any kind of exercise that you can think of. By giving to the Heart Fund, it just gives the people the ability to get their life back like it did me.
My name is Sharon Ford, and I have been a patient at Cookeville Regional Hospital in the heart program. I woke up with what I thought was indigestion. Paramedics said, "You're having a heart attack in the back of your heart." I thought, okay, I'm on my way to the hospital. They'll fix me up, send me home. I had actually had a heart attack a few days before, didn't know it. I had had pain in my back and didn't realize that I was having a heart attack. And that morning, my heart had actually ruptured. I had a left ventricle rupture. So they took me to the cath lab. Then he took me into surgery. Dr. Parsons was my surgeon. He gave me 3 bypasses. I had the artery that I had the heart attack in was 100% blocked. I had 2 more that were 70% blocked. And then he sutured up my heart. That happened in October. I started rehab the end of January. And I couldn't believe the difference it made. When I was halfway through the 36 sessions, I suddenly had all of this energy and stamina. It's like, wow, this is amazing how much difference it made. And I've been able to do what I want since. And if you are considering giving to the Heart Fund, do. This is a fantastic program. It makes such a difference. I've gotten so much of my life back because of the care that I have gotten at Cookeville Regional. We have been blessed to have the best here. People used to have to go to Nashville for all their heart care, and no need now because we have the best.